Okay, so Aniket has asked a very good question that in septic shock, we know that the first line is noradrenaline we need to use. And the second, we need to use vasopressin. So if your noradrenaline doses are going up, you need to escalate the dose of noradrenaline, then you need to add the second line vasopressin. So he has asked that what is the dose at which we should add vasopressin? So understand that in septic 2026 guideline, sepsis 2026 guidelines, there is no specific recommendation or suggestion on this, but there is a panel statement. They said that 85% of the panelists use vasopressin or add vasopressin to noradrenaline when the noradrenaline dose goes above 0.3 microgram per kg per minute. So the usual range, which is the intercurrental range, is 0.2 to 0.5 microgram per kg per minute of noradrenaline. So how does this translate into practical purposes? So we know that the one vial of noradrenaline contains 2 ml equivalent or 2 milliequivalent equivalent of noradrenaline in that. So if you make an infusion out of this one vial, so 50 cc will contain 200 microgram of noradrenaline. Now, if we divide it, so 1 ml contains 40 microgram of noradrenaline. Then if you keep on dividing by 60 and then again by 60, one for the converting into minute and one for converting into kg, it turns out that 1 ml of this one vial in 50 cc infusion, it becomes 0.01 microgram per kg per minute dose. So 1 ml contains if you start it on 1 ml per hour, then it will go to the patient as in the dose of 0.01 microgram per kg per minute. So now we need to start vasopressin when this reaches 0.2 microgram per kg per minute. So approximately translates to 20 ml of this solution is going out. So if your infusion is going about 20 ml per hour, in that particular case, you need to start thinking of adding vasopressin. So the range is 0.2 to 0.2 microgram per kg per minute to 0.5 microgram per kg minute. So this is the range in which they add vasopressin. So usually, if the noradrenaline single strength goes above 20 ml per hour, you start thinking of adding vasopressin. So this is a panel. This is what the panelist is doing. This is not a recommendation, but it is generally the panelist which made the guidelines. They do this, 85% of the panelists. I hope this helps. Do read more about it. Thank you.